welcome to Brain Chat. I'm Dr. Mitzi Joy Williams, your board-certified neurologist and MS specialist, and my mission is to engage, educate, and empower those affected by MS to become an active part of their healthcare team. Here on Brain Chat, we'll be discussing all things MS, health and wellness, advocacy, and we'll even throw a little bit of music and music therapy in there as well. Thank you so much for joining us, and stay tuned for the next episode. Well, happy Monday, everybody. I hope everybody's doing well. It's Dr. Mitzi, the nerdy neurologist, and I'm so excited to be back here with you for another episode of Brain Chat. I hope that everyone is doing well. I'm really excited about today's topic, and I'm really excited about the amazing guest that I have with me today. But before we go into any further details, first, we want to thank our sponsors, the National MS Society, for sponsoring Brain Chat. And we also want to thank you for taking out your time today to view our content, and hopefully you find it helpful. So we are going to be talking about mental health. Listen, it's Mental Health Awareness Month, and we need to be talking about mental health because it's so important to recognize that our mental health absolutely affects our physical health. And we see this not just with multiple sclerosis, but with many other chronic diseases and just with life in general. Because everybody knows when life be life, and it affects our physical abilities and our physical stability. All right, so let's get right into it. If you are logging on online, just type in the chat and let us know where you are viewing us from. I bid you greetings from Atlanta, Georgia, where it is very hot, and we are definitely trying to beat the heat. But let's get into this episode, which as I told you, I'm really excited about. I have the absolute pleasure speaking today with Dr. Erica Goodwin, who is a Harvard-trained, double board-certified child, adolescent, and adult psychiatrist. So listen, she covers all the things, okay? Although she primarily treats adults, she knows about all the things. And she is also the CEO and founding medical director of Goodwin Medical Associates. Welcome, Dr. Goodwin, to Brain Chat.
I feel like, was it Fozzie Bear that was like,
waka, 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 right? Absolutely. Thank you so much for coming to spend some time with us today. And I'm really excited about today's topic because I think we cannot stress and underscore enough the importance of our mental health. And the title of today's episode is Protecting Our Peace. And so I'm hopeful that by the end of this episode, our audience will have a little bit of a better understanding of some of the very common mental health conditions that affect us. What are some of those symptoms that are maybe under-recognized? And then what kind of tips and things can we do to protect our peace in the real world? Okay, because we can't just lock ourselves in our rooms and not speak to anybody or not interact. But certainly there are circumstances that can make us, if we allow the stress to overtake us, can make us really sick, for lack of a better term. Yeah. So before we get into any questions, first, tell us a little bit about yourself and how you got interested in the mental health space and how you chose that as a career.
Well, thank you so much. I mean, number one, I'm so excited. And I literally had an entire dance party with your opening music. How about that? I feel like everybody needs to give you a round of applause for having an entire bop for the intro of Brain to the Chat. But a little bit about me. So hello, everybody. I am Dr. Erica. As Dr. Mitzi said, I'm a double board certified Harvard trained psychiatrist, but I also am just extremely passionate about helping people be better, do better, and live better. I do that through my telemedicine program, which is Goodwin Medical Associates. I also am a traveling psychiatrist. I've worked all around the country. I'm the author of the book, Fix Your Fairy Tale, A Woman's Guide to a Great Life, Love, and Legacy. I do some speaking, and I'm also the host of the podcast Better with Dr. Erica. So I'm so excited to actually be on someone else's show. Means I don't have to do all the work.
Right.
How about that? And I do all of that just to help busy people who just, you give and you give and you show up for your friends, you show up for your family, you show up for your community, you show up for work, because I mean, we all show up for work, but you don't show up for yourself. And I do all this to help put you back in your life. And I ended up getting interested in mental health. That was kind of interesting. I was a sick kid that had asthma, and allergies. So I was at my pediatrician's office every week. I'd be in the ER all the time. I turned blue on way too many doctors.
Mm.
Cool. And naturally, I decided I wanted to be a pediatrician. I want to be a pediatrician all the way to when I started medical school. And if you all don't know much about med school, our third year is where a lot of us in the traditional way med school is done, is that's when you actually do your clinical rotation. So that's when you actually get to do the stuff. But for me, the summer before third year started, I literally woke up with an epiphany that I was going to be a child psychiatrist. Didn't have reason the first, had no idea, had never done it, never seen it. And I woke up with this idea I was going to be a child psychiatrist. So I'd say the original thing that got me into the field is actually divine intervention. And then I came up with reasons. I found reasons. I love that there's something intimate about the conversations that I get to have with people, and the fact that I get to help people when they're in their most vulnerable. I get to know everyone as humans. So naturally, my job is never boring. And I get to do something that really makes a difference for people, because I truly believe that quality of life, one of the biggest foundational principles to give you good quality of life, is actually mental health, which is one of the reasons I believe that good mental health is actually a human right.
I love that. And so my story is a little bit similar to yours, in that during that third year, we do all different types of rotations. And before I went into that third year, I actually also wanted to be a pediatrician. I think everybody wanted to be a pediatrician before they went to med school. So I wanted to be a pediatrician. Yeah, because, I was like, I'm going to take care of all the babies. And then, of course, I did my rotation, and honey, those babies were sick. And guess what? I was sick the whole time. God bless you, all pediatricians. But there were so many sick visits. And when I tell you every runny nose gave me a runny nose, I was like, this is not the life for me. But I like the idea of neurology. And by the time I finished all my rotations, there was nothing else that I liked better than the idea of being a neurologist. And so that's what made me apply to be a neurologist before I ever did a neurology rotation. I do not recommend that as a strategy for most people. But thanks to divine intervention, it worked out for me.
Yeah.
And I am doing what I love. But yeah, so very similar stories there. And I also like the idea of that journey and being on a journey with people, which is what led me into multiple sclerosis. So lots of similarities there. And I actually thought about psychiatry, but neurology was kind of like a middle. I get to work with the brain, but I also get to like examine people with my little hammer and stuff. And so it was like, that was kind of a good middle ground for me. But I love psychiatry and actually incorporate quite a bit into my practice, which is why I'm so interested in this topic of mental health, right? So many times when people come to the doctor, they're so focused on their physical symptoms, and absolutely there are physical symptoms that are due to diseases and things of that nature. But some of the time we find that when we get to the bottom of some of those symptoms, it's really the mental health that needs to be addressed. So you said a term that I want to dig into a little bit. You said good mental health is a human right. Tell us what good mental health looks like.
Quite simply, I'd say feeling good and having positive emotions, because some people look at good mental health as being happy all the time. And I don't know how many of you have watched Inside Out, the first one or the second one. And I believe my entire social media timeline is filled with the second one. Is that the expectation that to have a good life, you have to be happy every single minute of the day is unrealistic. That's just not life.
Right.
But good mental health is being able to feel like you have control of your emotions, that you actually can feel joy and positive emotions, and that you actually physically feel decent and you have mental clarity and you feel like you can be who you truly are.
Yeah. I love that, and I think it's so important to kind of touch on that, because they're really, we were never really taught about an expectation for mental health, and so I think when people have this extreme in their mind that they're supposed to be happy all the time, and when they don't meet that they're not mentally healthy, I think that, that's very imbalanced. I always tell my patients, listen, if you're awake, there's going to be stress. I mean, as long as you're awake, there's going to be stress, but we have to learn how to navigate that in a healthy way so that it doesn't make us sick.
Right.
And thinking about this term stress, I have a lot of folks that come in to see me that say they're stressed, they're stressed, they're stressed. Let's talk about what this term means and how sometimes that term that people use for stress can actually be symptoms of depression or even symptoms of anxiety.
Well, for some people, and I feel like stress is one of those words that it has a zillion meanings, or you could say it and nobody actually has an idea of exactly what it is. And I look at
Right.
stress is feeling pressure, stress
Mhm.
can be feeling nervous, stress can be feeling overwhelmed. It can mean a variety of things. I think part of it is how what that amount of stress feels like for you and
Mhm.
how that impacts you.
Mhm. So when we think about eustress or positive stress and negative stress, let's talk a little bit about kind of the differences between those two, because there are some stressors that are good, right? If you have to study for an exam or something like that, kind of that little extra pressure to get it done can be healthy. Or if you're in a dangerous situation, the stress to run from a fire or things like that. But then there also is bad stress. So let's talk about the difference between those two and how we distinguish them.
Well, one is just some baseline situation that you just need to do something for. So,
Hmm.
you mentioned a test or there being some urgent issue that is life altering that you have to actually make a decision and get into the traditional stress response. But to me, when I look at when stress kind of turns into something that's really negative, a lot of it is how that stress makes you feel.
Hmm.
If it's there are plenty of people, we'll use your example of needing to do a test, or we can switch it over to you have a project at work or deliverable at work. And there's some people that they have a deliverable, they feel a little stressed that I need to get it, and that just kind of fires them up and they're like, okay, when I feel a little pressure on it and it gets a little closer, I'm there and that's when I show up versus
Hmm.
the person that the thought about it just becomes so overwhelming or you feel like you can't do one more thing, that a lot of it is how you feel about it and how you perceive it.
hmm Yeah, I think that that's extremely important. Something else that comes to mind with this topic of stress is that sometimes when I'm in the clinic, my
Mhm.
patients will use this term, I'm stressed, and then they'll start describing to me things that are, let's say, symptoms of depression, really,
Mhm.
right? Where they begin to isolate themselves, or, they don't do activities that they usually like to engage in. Let's talk about some of those subtle symptoms of depression that sometimes people misinterpret as stress, because I think sometimes when people think of depression, they think of a very extreme case, maybe someone who is completely debilitated where they can't leave the house and they don't groom themselves. But there are lots of people walking around, going to work every day, that are suffering from undiagnosed or unaddressed depression. Kind of like when we talk about walking pneumonia, right? There's a pneumonia that puts you in the hospital, but you can be walking around with pneumonia and feeling kind of bad, but still able to function. So let's talk a little bit about that in a little bit more detail.
So I'd say some of the symptoms that I think people don't pay quite I can't talk today. I am tongue tied. So I appreciate all your people dealing with my tongue tiedness. Is that one of the things that people don't always notice is something that you kind of touched on. Now, if all y'all out there want to sound really smart, there's a word called anhedonia.
That's a big one.
Anhedonia. And all that means is this feeling of blah, like nothing really feels good. Things that you enjoyed before, you just don't really enjoy. So it's just blah. To me, that's one people overlook. And then
Mhm.
also, a lot of times you'll see people will start isolating. So people will stay in their room more. If they're in
Mhm.
a family environment, they may eat by themselves or spend more time in their room. You're either not showing up or canceling social engagements. You might
Mhm.
be letting the phone ring and not answering, or hitting that button that says do not answer, go straight to
Mhm.
voicemail, or you're getting
Mhm.
text messages, you're not responding to them. So the isolation, the anhedonia, irritability. I feel like a
Mhm.
lot of times people are looking for sadness and crying spells. And there are times where primarily people are more irritable than actually subjectively feeling sad.
Mhm.
And the other one I think that gets overlooked a lot is poor concentration. And that may
Mm,
not be that you can't concentrate at all, but some of the things you may notice is that you're making more simple mistakes at work. Your tasks take longer to do. You may notice things your tasks take longer because you have to go back and check them a few more times. Uh,
mhm.
you may notice that someone may ask you to do something, or you may be in the middle of trying to take care of housework and you just can't quite seem to focus to get it done. But I think that concentration piece is also one of those that often gets overlooked.
Yeah, and that is an extremely important one, particularly for our MS population, because concentration issues, particularly
Mhm.
multitasking and memory, can be symptoms of MS. And so, oftentimes, when people come in and say, "Hey, my memory is not what it used to be, I'm having more difficulty," we want to make sure that we're not dealing with underrecognized or unrecognized depression, which can contribute to those things. Also, things like fatigue, right? So, there some symptoms that overlap with neurologic diseases. And it's important that we're recognizing any type of mood issues because those can have similar
Right.
symptoms. And really, we need to be addressing that and not necessarily changing the medicine for the overall disease. And then another one that we see very commonly is the irritability. Now, I tend to notice that a little bit more in my male patients. So my women are irritable, but oftentimes when my gentlemen come in, and they're having depressive symptoms, it seems like they talk a little bit more, or their wives or spouses
Mhm.
talk a little bit more about them being very irritable, very easily angered. Is there a difference in symptoms in men and women?
It varies, and I think also how it shows up and how people
Hmm.
tolerate it can be different. The other group of people that have a lot of irritability are kids.
Mm,
You'll
yeah.
often see irritability sometimes will sit a little bit more forward than that traditional sadness.
Yeah. Yeah, well, I think it's really important again because oftentimes these words that we're using may not adequately be describing what's going on. And once we kind of dig into it, it's like, this is a little bit more than your typical, like, I'm just stressed out about this situation. We may need to address this. Now, let's switch gears a little bit and talk about anxiety. This is another big one that we see very commonly. So, in people with multiple sclerosis, we commonly see that the top
Mhm.
two psychiatric comorbidities or issues that we see in the MS population are depression and anxiety. So we know that over half of people who are dealing with MS will deal with these conditions at some point during the course of their disease. You know, with the anxiety, some of that we know is related to the fact that it's a very unpredictable disease, right?
Right.
So somebody can wake up one day and not be able to see out of one eye, or they can wake up and have numbness and tingling, or if something is not working right in their body, they might be like, oh my God, is this my knee? Is this my MS? You know, so there's a lot of fear of the unknown, which is a very natural response. But what are some of the symptoms or things that would indicate to us that, okay, this is beyond that natural response, and we probably need to get that addressed in terms of anxiety?
Well, there's one thing I want to add on to what you mentioned also that I think is
Yeah.
probably big in your population is, one is the uncertainty. The other is the medical trauma of actually going through it, the time spent in
Yeah.
the hospital, the procedures.
Mhm.
I don't think anybody is happy about having spinal taps.
Nobody likes
So
spinal taps.
so I
As
mean,
a matter of fact, when I give talks, I always say, "Has anybody ever had a spinal tap? Raise your hand." And then if I say, who doesn't know if they had one?" I'm like, "If you raise your hand, you ain't have it. Because if you don't remember, you definitely it's something that you do not forget. That's usually not in a good sense." Go ahead.
yeah. So one of the things, we talked about it, and the interesting thing is there is some overlap on some of the things that we talked about for depression that happen for anxiety,
Mhm,
because you can also have that poor concentration on that side too. You can also
mhm,
anxiety shows up really often as irritability,
mhm,
and trauma reacted behavior, which is kind of goes with anxiety for some people too, can show up as a lot of irritability or dysregulation. You can still get that isolation and avoidance. And it's that restlessness, because I
mm,
think sometimes people are looking to just feel super, super nervous. And sometimes people are just feeling really restless, like they can't get settled and they don't feel comfortable in their skin, or,
Mm,
and I think the other thing other than concentration too is those racing thoughts. And, there are times where if people look up mental health stuff, people will say racing thoughts equals bipolar. If you actually said how many times, where do I see racing thoughts the most? It's actually more with anxiety
mm,
than bipolar disorder, because it's all these thoughts and it's all that rabbit hole thought, and then the
mhm,
catastrophic thinking that something's horrible is going to happen, you're going to die, you're
mhm,
not going to wake up. And I think those things are even amplified in your community
mhm.
because people have legitimate illnesses that something really bad could happen.
Absolutely.
And their fact and their reality based thinking is on one end that some bad things have happened. It's not the bad
Mhm.
gonna happen tomorrow, and it's all of your
Absolutely.
thoughts. But the big word that kind of comes up with a lot of this is impairment. So
Mm,
there are times that people can feel anxious or nervous, but they're functioning fine. They subjectively feel nervous sometimes, but it's not getting in the way of them working. It's not getting in the way in their daily lives. It's not getting in the way of their relationships or any of that stuff. And when a lot of these things become a problem is when these things get in the way.
mm,
So you're not able to positively socially interact with people. You're not able to do your tasks at work or at school. You're not able to handle, I'm sure everyone has probably heard, because most of your population has probably been in a hospital at some point, and someone mentioned ADL. So activities of daily living that,
mhm,
it's getting in the way of you being able to shower, eat, get dressed, those
mhm,
kinds of things. But it's just
mhm,
when it really just gets in the way. And the other one is kind of, I look at it as when in every situation, all you can see is a catastrophe,
mm,
when all you can see is a worst case scenario.
mhm. Yeah. Yeah, so those are all important kind of red flags and signs that, okay, this is, something that definitely needs to be addressed in
Mhm.
a medical setting, you know. And one of the places where I often see those racing thoughts that people report to me is when they're trying to go to sleep.
Mhm.
So many times it shows up for my folks as insomnia. They're trying to go to sleep, but they can't go to sleep because they can't get their mind to settle down, or they're waking up in the middle of the night, which, we always talked in medical school about those early morning awakenings, waking up at 3, 4 o'clock in the morning for no reason, which can be a sign of depression. And so, I think it's important to recognize that that also is an impairment. So people may be able to go to work, they may be able to take care of their kids, eat dinner, but when they lay down and try to go to sleep, they're getting an hour or 2 hours because their thoughts won't allow them to settle down. And so I love what you said, that, the thing to look out for is if it is impairing your everyday life and your ability to function. So when we think about, we kind of talked some about the issues, we talked about some of these symptoms. One thing that I'm really a big advocate for on Brain Chat is, what do we do about it, right? So we talk about the problem, but mainly we want to get to, what do we do about it? So there are many different ways to treat these
Mhm.
conditions. I think the first thing is recognizing that you have an issue. And we talked about that. I think the second big piece is bringing it up to your healthcare provider and not being afraid or ashamed to do that. So, kind of, what is the path that people go through, to get these symptoms addressed? I know sometimes primary care providers may see someone and prescribe a medication. When should someone see a psychiatrist or see a therapist, and or both?
Okay. So, I think you brought up one of the biggest things, which is actually see somebody.
Right.
Because I look at it as it's important to have mental health checkups like you would get a physical. Is
Mm,
that there's nothing wrong with questioning, is everything okay? And getting checked out, and someone might say you're all right, you're actually good, don't worry,
mm,
or there is a problem and there's something we need to do about it. But the one thing I hate happening is when people are out there struggling and they don't need to struggle, because you can't get time back. And you're also, people with MS that you never know when your functioning is going to change. So time even takes on a really even more critical meaning. And one of the reasons I'm a fan of people seeing psychiatrists is one of the things that we can do is the fact that we're actually taught in a medical model and go through all these different things. So sometimes we're better equipped to kind of see where things are intersecting
mhm,
and to assess what may be a traditional mental health issue and what may be actually due to something more related to your physical health because the interventions aren't the same.
Mm. Mm.
You know, if
Yeah.
if if you're depressed because your MS is a mess, Prozac's not going to fix it.
Mm.
You know,
Right.
so it's important to be able to identify what is actually going on.
Mm-hmm.
Uh, so that's something we're actually really good with. And one of the things I always like to let people know is they always think that all psychiatrists do is give pills. We actually can do therapy. So actually in my personal private practice, I actually have a lot of therapy patients.
So
Um,
I love that. I love that. So let's pause right there. So a couple things you said that really stuck out to me. I like this idea of a mental health checkup. So tell me what that would look like. Would somebody just go to see the psychiatrist once a
yeah,
year, like they see their
yeah. I mean,
PCP once a year?
you can. I mean, that's the thing is a lot of times people look at mental health care as crisis care. So
Mm,
it's I go see someone in mental health when I'm a mess.
right.
And usually it's big mess. Like, you know, I'm thinking of hurting myself. I'm thinking of hurting someone else. I'm hearing voices. I'm seeing things. I can't get out of bed and I haven't showered for 2 months.
Hmm.
But the thing is just like a lot of the other medical fields, will take, you know, a lot of people are familiar with high blood pressure or diabetes. So if you see someone and it's really super minor, then you can do those lifestyle modifications, diet, exercise, get sleep, stress reduction, all those kinds of things. And then you actually don't even end up needing medication sometimes. You
Mm,
take care of it when it's early versus if you have somebody with diabetes and they come in and they're basically in diabetic ketoacidosis and about to die, and you send them to the ICU and try to keep them from dying.
mm.
The thing
I
with
like that. I like it. Go ahead. Go ahead. I'm sorry.
And the thing with us is if you come to us when either it's like a little question of maybe not right, or hey, let me just check and make sure that I'm in the best position possible. Because I
Mm,
have some people come to me and they're pretty much just like, hey, you know, I'm getting a little older, I'm having more responsibilities, you know, life is changing a little bit. I just want to make sure that I'm okay and that I'm doing the best I can to be at my best. And I think people forget that we can also be used for that too. We don't have to be used for a crisis. And, you know, some of us are seeing people that don't actually have diagnosable mental health issues, that don't meet
mm.
criteria for major mental health issues, but maybe stressed out, overwhelmed, or just trying to figure out the best way to navigate change. But back to the original question is you need to get assessed by a trained professional. And if you don't see a psychiatrist, you want to see someone with a high enough skill level that they can fully assess you. Um,
Oh, so I'm intrigued, right? So now I'm writing in my mental notes. I need to start sending everybody for a mental health checkup. I love it, right? Because I think we need to destigmatize this idea of if you see the psychiatrist, you're in horrible shape, right?
Mhm.
Or if people are stressed, they'll be like, no, I'm not that bad. So I think we need to normalize seeing a psychiatrist just like you go see your primary care doctor.
Yeah.
I think also we need to normalize the fact that taking care of your mental health is equally, maybe more important. I won't say more important, but equally as important as your physical health, right? So I always tell people, listen, if your chest is hurting, you're not going to sit there and be like, well, let me see if it goes away. You're going to call 911. But if you're crying all day, you're going to sit there and just try to wait it out to see if it goes away, or you're having these symptoms or not sleeping at night, et cetera, et cetera. And so we need to address that mental health just like we would address any other thing. If you have a pain, if you have this going on, you're going to go get it checked out. If you can't see out of one eye, you're going to get it checked out. So if you're having these signs of stress that we talked about that are beyond, your regular dealing with a test and they're interfering or impairing you, we definitely want to get it addressed before it gets to the point where you have to get hospitalized or you're in some type of crisis mode and have a breakdown. So I really, really love that idea of a mental health checkup. So seeing a psychiatrist who is a trained medical professional is important. Tell us the difference between a psychiatrist and a psychologist and a therapist.
Okay. So the first thing, a therapist can be anybody.
Okay.
So a therapist could technically be a psychologist, a therapist could be a psychologist, a therapist could be a social worker, a therapist could be a
Mhm.
licensed counselor. So therapist is just kind of a general word for anybody that can do therapy.
Mhm.
Then when you get to
Now,
psychologists.
have these people received additional training? Because I have some people that say, well, I go talk to somebody and get therapy at my church, right? I see a spiritual counselor, but sometimes there are some people who have additional training focused on counseling specifically, and some who may not. So, what's that delineation?
To me, anybody that's actually given therapy is trained in it. Now,
Okay.
the training can be different. So, like the amount of training a licensed clinical, like a licensed counselor is going to be different than a licensed clinical social worker, which is different than a psychologist, which usually they're either a master's level or a doctorate level, such as a PhD or PsyD.
Mm-hmm.
And then you have psychiatrists that are medical doctors, and we have a minimum of 4 years postgraduate training after medical school. I actually am a
Mm-hmm.
subspecialist, and I did the most out of those years, so I did 6.
Mm-hmm.
So I mean, I think one is, and one of the reasons we talk about different people is people have different amount of training, and
Mm-hmm.
also there's a difference in the amount of training of someone that may be like a psychiatric nurse practitioner
Mm-hmm.
and a psych PA than a physician, because they're not in school as long and they don't do as all these years of postgraduate training.
Right.
The big difference between a psychologist and a psychiatrist is psychologists can do psychological testing. No one else
Mm-hmm.
can do it. So we don't do psychological testing. Social workers don't do psychological testing, and licensed counselors don't do psychological testing.
Mm-hmm.
The other testing that your population would get also probably is some neuropsych testing.
Absolutely. We refer for a
Um,
lot of
and
neuropsychological
that's
testing.
only done by psychologists.
Mm-hmm.
So if you need testing, there's only one person you're going to see. You're going to see a
He's a
psychologist.
psychologist. Mm-hmm.
And then depending on what you're looking for, you may see us, you may see someone else. And then there are different therapeutic modalities, different types of psychotherapy, and different people will do them and some do not. So,
Okay.
and that's not always kind of spread across um, specific, I can't talk today.
You doing great.
Specific discipline, because I
Uh-huh.
think the other thing is a, a lot of people have had trauma. So then there are some therapies that are very um, evidence based for trauma.
Mm-hmm. Yeah, so I think that's really important for people to recognize that different, providers have different levels of training. If possible, I always would love for someone to see a psychiatrist, and then oftentimes I will have patients that may have a psychiatrist and a licensed
Mhm.
therapist, depending on how much therapy they need, right? You may not be able to see your psychiatrist every week, but certainly they're kind of the head of the ship, kind of steering the ship. And then you also have, your other person that you may see more frequently. So, I think it's important to recognize the different avenues that people can go through to get help. So when we talk about treating these symptoms, let's circle it back to protecting our peace, right? So protecting our peace, dealing with our mental health, trying to get an understanding of what good mental health looks like for us, speaking up, getting help when you need it. How do we kind of where do you start? So let's say we have someone who is having issues. Let's say they got in to see the psychiatrist or seeing the therapist. What are some of the things that may be employed to help them? For instance, psychotherapy versus
Mhm.
medication. And then, we'll get a little bit into like lifestyle modification and what they can do to help themselves.
So, yes, we can get psychotherapy or medication. A lot of cases will do both.
Hmm.
Um, but my thing about medication, my personal feeling about medication is minimal medication for maximum effect. I'm not a fan of people just getting pills to get pills, and everyone doesn't
Hmm.
actually need medication. And there
Right.
is a significant amount of crossover with some of the medications that neurology uses and we in psychiatry
Hmm.
uses. So,
Absolutely.
so there are times that I've had patients that are in the care of neurologists that they don't need another med, that potentially from a medication standpoint, what they're getting from neuro may cover them enough. And then we're doing
Hmm.
some other interventions. And then pardon me, I'll be honest, the other thing that can affect your mental health is menopause.
Yeah, they can.
I am personal summaring right now, so I may glisten a little bit more
That's okay.
for your community
No problem.
because
No problem. We don't mind the
I
glistenings.
think my Nest thermostat is not smart, and it has made my house hot. And I don't know if I'm having a personal summer or if it's hot in here because it's a million degrees
It could be a little bit of
in
both.
Northland
It could be a
Atlanta.
little bit of both. Yeah, and
But
that's important, right? Because sometimes those life transitions can also affect, right? So MS primarily affects women 3 times more commonly than it affects men. So these are issues that we are just getting under the surface of in the neurology space, right? What does menopause do to that mood and those symptoms? What do those hormonal changes and all of those things, how do they affect what's going on? And so a lot of times people are like, Dr. Mitzi, I don't know if it's the menopause or if it's the MS. And I'm like, well, you know what, honey? I don't know either. So sometimes we got to try to sort all of that out. So we're often kind of trying to
yeah,
piece together, what do we think is related to life, what do we think is related to MS, what do we think may be related to other
mhm,
conditions. So that very commonly happens. And so when we talk about therapy and we talk about medication, again, I love that approach, that you described, minimal medication for maximum effect. But I think there still is this fear in our community of medication, like it means that something is
yeah.
horribly wrong with you. I don't need medication. Let's talk about some of that stigma
Okay.
associated with medication for mental health conditions.
Well, the first is, I think the first myth or stigma is that people think if they see a psychiatrist, automatically we're going to give them a bunch of medicine. And there's a word that comes up that it's got to be in the Urban Dictionary by now because I've heard it spontaneously from people all over the country. And they'll say, I don't want to be zombified.
Okay.
Yes, people
That's
say
a new
it.
one.
Yeah, I hear it all the time. I have heard it so many times in multiple areas, probably a little bit more in the Midwest and the South, but I have heard it. And people are afraid that they come and see us, we're going to automatically give them medicine. And not only are we in medicine, we're going to give them a lot of medicine. And they're going to be walking around all extra special. The other myth is that being on medication, these medicines are addictive. They don't want to be dependent on the medicine.
Mm-hmm.
The honest to goodness truth is the average antidepressant actually does not have any addictive potential.
Mm-hmm. Yeah.
There's some medicines that are monitored closely because, now there are some other therapies like ketamine and some other things, but you can't actually just go get ketamine and take it home.
Mm-hmm.
They actually,
Absolutely.
ketamine is
You
actually
better not be able
monitored.
to.
It's actually monitored in a monitored environment. Typically it's either done with a nasal spray or an infusion, and you're actually monitored when it's given and a while afterwards. But in
Mm-hmm.
general, the thing is the medicine is not addictive. Well, antidepressants aren't. That's part of the reasons why we have what we'll call controlled substances versus not really controlled substances. So
Mm-hmm.
those are ones that potentially can have addictive or misuse potential if not prescribed or used correctly.
Okay.
But that's not the majority of medications people are on. And
Okay.
it's one of those things that most of these things are very safe when used appropriately.
Yeah.
But the thing
And
is,
then I'm sorry, go ahead, Dr.
the
Mitzi.
average
Go ahead.
medicine that you're on really probably will not have any addictive potential. Because people will think,
Mm-hmm.
oh, if they get an antidepressant or something like that, that they're going to be addicted. They're
Mm-hmm.
not addictive. The other is that they're going to be super sleepy, and most of the stuff
Mm-hmm.
is not actually sedating. And if it is, you have a conversation and someone changes you. People are concerned about fertility. I've had people like, am I going to be able to get pregnant if I take this medicine? Or not even, well, can I get pregnant? It's more of, years down the line, will I not be able to get pregnant because I took this medicine?
Mm-hmm.
And I think the other thing is just people are concerned about the stigma in general. A lot of times people
Mm-hmm.
don't want to know they were ever seen for mental health.
Yeah.
So, just kind of the trail of pills and medicine people get kind of uncomfortable with.
Yeah. So, my conversation with folks is okay, it's a doctor's appointment. Who's going to know you saw a psychiatrist unless you walk around with a sign on your chest saying, I saw a psychiatrist today, right? And then who's going to know what medication you're taking unless you walk around with a sign on
Yeah.
your forehead saying, I'm taking antidepressant medication. Again, whenever you're seen by a psychiatrist, mental health, specialist, the goal is for them to assess you and see if you need that, right? If you don't need it, okay, cool, But again, if your chest is hurting and they told you to take, this pill to keep your chest from hurting, you would do that, right? So if we need something to help stabilize our moods, I think that we should at least explore it as an option. The other thing that I very commonly talk to people about when it comes to medications is, the goal of these medications, again, is not to make you happy. I always say there's no happy pill that's legal. All right. So, what is the goal of these medications, right? So, we know it doesn't swing you all the way to the opposite, right? So, if you're depressed, it doesn't get you to like where you're euphoric and happy go lucky all the time. But what is the goal of taking a medication, let's say for depression?
So the goal of taking medicine for depression is to, decrease the depressed mood, decrease the irritability. So you want to get people to a point where their mood is average in the middle. So, one of the things people are like, is it going to numb me? The goal is no. The goal is, if it does, we're going to change it. Is
Right.
that I want you to be able to feel.
Pause right there and say that again for the people in the back. If you take it and it doesn't like, and you don't like it, or it doesn't make you feel well, then
You change
you
it.
talk to your doctor, and they can change it.
Well, and that's one of the other big things is anybody you see, you should be able to have a collaborative conversation with, that you
Right.
should feel comfortable asking questions, being collaborative and discussing the plan. I'm not a big fan of the traditional old school paternal model where you see someone and they just tell you, this is what you're going to do, this is what you're going to take, bye. You should be able to ask plenty of questions so that you're comfortable with whatever the plan is. Because I may be an expert in psychiatry. Dr. Mitzi is an expert in neurology and MS, but you also are coming to the table as an expert in you.
I love it. You take the words right out of my mouth. We talk a lot about shared decision making in my space. And so that sitting down with the doctor, talking about, you're the best expert on yourself, what your lifestyle is, what your symptoms are, and then working with that person to come up with the best plan for you. So that is absolutely right in line with,
And when
our model in the MS space.
And that's part of the conversation a lot of times we'll have too, because I'll have some people, we know that a lot of psychotherapies take a while. I won't say a long time, but they take a while. You're not going to take it and all of a sudden the world's changed. And sometimes people are feeling bad enough that it's like, well, let's give you some medicine to help things get more stable while you're doing your psychotherapy, to let the therapy kick in, because you feel so miserable. There's no reason for you to wait months. But back to your original question is, we want you to be able to feel regular emotional shifts. If something happens that should make you mad, you should be able to get mad. If a dog dies, you should be able to feel sad. I want you to still have a normal, right? But a lot of it is just bringing it back in, kind of
Right.
like an old school.
So it's not a huge,
it's like this. It's more like
yeah.
this. But also that gives you an ability to have a capacity for positive emotions and the capacity for emotions, because a lot of people will feel just kind of numb. They'll feel down or irritable, but they'll feel kind of numb. So back to the point where you actually feel like you can actually feel more emotions. You have the ability to have positive emotions, that you're able to have mental clarity, an appropriate amount of energy, be able to sleep, have a normal appetite, and be able to engage with the world in a positive, healthy way.
Yeah. So I love everything that you said, right? Our goal is really to kind of even you out, right? So we want you not doing the big swings back and forth, but just, you can still feel those emotions, but not to the point where it's kind of getting out of control, where you can't function and it's really impairing your everyday life. And then, we actually, this time has gone by so fast, Dr. Erica. It has gone by so fast. But before we, wrap up, I do want to take a moment to talk about lifestyle modification. I'm also a big advocate of things that people can do for themselves, right? So seeing the doctor is important. If you all come up with a medication regimen, it's important to stick to that. Or if you're having trouble, to reach out, let your medical team know. But I'm also very much about empowering people about things you can do for yourself that may help boost mood or deal with anxiety. We talk a lot in my clinic about meditation. We talk a lot about yoga. We talk a lot about mindfulness practices. We talk about exercise, which can boost mood and also help with sleep and anxiety and things like that. What kind of lifestyle modification things, do you see on a regular basis that can help people to also combat these symptoms in combination with working with their healthcare
Okay.
team?
So I have a concept called the Better Seven, these seven essential areas that are just important for you to be better, do better, and live better. And there are a couple of them that I think are really helpful. One, as far as lifestyle modifications, is support.
Mm,
So support shows up in a few different ways. One is just literally friends and family that are around to listen to you and be there. Um, that can also help it happen in the workspace as far as support. But also, I look at it as not just simply emotional support, it's literally support. So, one is if you have financial resources, what are things you can take off your plate?
mm,
And for some people, it's something as simple as having a laundry service and doing wash, dry, fold, which is what we call it on the Northeast, but not having some of these things on your plate, grocery delivery or getting meals prepped or those little meal delivery kits are the ones where the meals are already actually done. Anything that
mhm,
takes all these millions of things you have to do off your plate. Maybe if you don't want it necessarily someone coming in your house to clean it every month, every week, but maybe once a month or once every 2 months to get a lot of that big stuff done. Just
mhm,
getting a lot of that stuff that just keeps you busy doing things you don't want to do and start getting to me. That's also a level of support. Another is being
mhm.
able to delegate. Some of
Yes.
it is delegating tasks in your household, because I know you mentioned that a lot of your community is women. Well, a lot of these women have spouses or partners or kids. Everyone can have tasks, you know.
Absolutely.
So it's like delegating things at home, either outsourcing totally or to people that live in the house,
Mhm,
being in a place where you learn how to delegate appropriately at work so that you don't
mhm,
have so many tasks. Getting your wellness team together. I'm a big fan of a wellness team. Most people need more, need a bigger wellness team. At a minimum, you need at least a primary care doctor, you need a dentist, but you need
mhm,
a wide variety of things that are nice. You have a mental health provider, if you're someone that's using chiropractic or, acupuncturist, but making sure you have your support is also your wellness team. And that may shift depending on what you need. And depending on what you're going through, a coach may be helpful, but just having
mhm,
having support so that, the big thing is so you're not doing everything on your own
mhm.
and that you have the time to devote energy to healing.
Mm. I
Um,
love
and
that.
and the other thing is part of the reason you need that time is you need to be able to go to sleep at a decent hour to get the sleep
Mhm,
you need. If you don't sleep well, you just insomnia alone without any other mental health condition, without any neurological, physical condition, you're not going to heal as well. You're going to possibly be tired, have poor concentration, have irritability, all just from not sleeping. But one of the
right.
reasons people aren't going to bed on time is because they have a million things to do.
Mhm.
So
Yeah,
so it's having that support, but also being able to prioritize what's a to do, I want to do it, or must do,
right.
and getting the must do's done. But the other stuff, whatever happens with it, is what happens.
Mm,
Majority of those things we're all stressed out about. Nobody's gonna die.
right. Absolutely. It is not the end of the world. And so I love everything that you said. Is certainly things that, I personally work on, right? So I tell people, listen, I'm not telling you what I heard, I'm telling you what I know, right? These are things that will absolutely change your life. And when you don't pay attention to them, you definitely can get overwhelmed when you're trying to do everything. And so I tell people, we're renovating our office space. And I say, when we get our new office space, I'm going to put a sign up that says, leave your super cape at the door, right?
Mhm.
Because oftentimes we're trying to walk around with these super capes on and do everything for everybody, and we leave nothing for ourselves. And you cannot, give out of a vessel that's empty.
That
right?
is true.
Without harming yourself, right? So you certainly can try, but it's going to be to your detriment. So it's better if you are filling yourself up or leaving space to fill yourself up
Yeah.
so that when you give, it is not to your detriment all the time.
That is
And
so
so
true.
that's a whole word, honey. So as we are closing, tell us how to find you, Dr. Erica. Tell us about your podcast. Tell the people where to find you.
Perfect. And I'm going to take this liberty. There was one thing I didn't say that I want to say is let people
Sure.
know you need help.
Please say it again for the people in the back.
Let people you let people know you need help, because the first thing is there are plenty of people that would love to support you, that if they don't know, people aren't mind readers. They're not going to do it. The next is let people know you need help because it gives them permission to actually help you.
Mm.
And let people know you need help. And sometimes when you're talking about friends, family, or even at work, let them know what kind of help you need.
How about that?
Because
Be specific.
yeah, so people can show up with what you need, because there's some folks that what they need is a sounding board. Some people may need just somebody to watch their kids for an hour, to take the dog for a walk. Someone might just need someone to sit around. Someone might just want somebody to know. But people need to know how to show up for you so that
Mm.
it actually feels good for you and feels like people are there. The other reason it's important is there are different domains that we're all in, and if someone doesn't know you're struggling, they're going to misperceive what's going on with you as something totally different. Probably
Right.
there are two places this is hugely obvious. One is work or school,
Mm-hmm.
where someone will think maybe you can't do the work, you don't want to do the work, you're not interested, and that may not be the case.
Right.
And also, it can impact your interpersonal relationships, especially romantic relationships, because someone says you feels like you don't like them, or you're not
Right.
interested in them, especially when you have issues where when people aren't feeling good, then their libido typically goes down. And when people feel
Mm-hmm.
like, you're not connecting with them physically, they feel like you don't want them. So just want to say that. But how you can find me. So we mentioned that I have a podcast called Better with Dr. Erica. You can find me on all podcast platforms. I'm there. Just look for
Okay.
Better with Dr. Erica or go to betterthepodcast.com. You can find me on
Awesome.
all social media at Dr. Erica, but it's spelled out DoctorEricka. And for your people, because they're good people, because if they're your people, they're good people. I
Absolutely.
do have a bonus. It's a coaching guide around anxiety. It's called Feel Better, 5 Tips for Overcoming Anxiety. And you can find that at feelbetterbonus.com. That's feelbetterbonus.com. And thank you so much for having me. It's been a blast.
Awesome. Well, listen, this has been an amazing conversation that I know will help so many people. I mean, I'm like, listen, I'm taking notes over here myself because this helped me. So thank you, Dr. Erica. Thank you for coming on to Brain Chat. Thank you for sharing your wealth of wisdom and knowledge. I'm sure that our viewers will appreciate it. Thank you to the MS Society for sponsoring us. And thank you to all of our viewers and listeners. And we will see you again in 2 weeks.